Hello everyone, my name is Tiara Audia, NPM 1916041031 from class Regular A, majoring in Public Administration, Faculty of Social and Political Science, University of Lampung. This video, I will discuss about Covid-19's impact on public welfare and health. Coronavirus disease or COVID-19 is a contagious respiratory and vascular disease caused by severe acute respiratory syndrome coronavirus 2, a specific type of coronavirus. Who doesn't know about the COVID-19 pandemic? A virus that has infected Indonesia and throughout the world recently, where it has become a global problem that must be addressed immediately, because the intensity of the negative impact is felt by all aspects of life and lines of society. The welfare condition here is also questioned, whether it is fulfilled or not. If you look at the situation and policies that have been set by the government, the social welfare condition does not work as usual. It can be seen from the social side that is limited. Then, the mental health of the individual is affected by the anxiety and stress of contracting the virus. Whether or not the daily needs are fulfilled or the social assistance that has been provided by the government is appropriate or not, in Law Number 11 of 2009, it has been explained that social welfare is a condition for the fulfillment of the material, spiritual, and social needs of citizens in order to live properly and be able to develop themselves, so that they can carry out their social function. Until 29 October 2020, positive case of COVID-19 in Indonesia reached The question is, how is the development of COVID-19 in Indonesia from a health perspective? What are the government handling steps? And then discuss about Sustainable Development Goal 3, good health and well-being. What is Sustainable Development Goal or SDGs? The Sustainable Development Goal (SDGs) are a global action plan agreed upon by world leaders, including Indonesia, to end poverty, reduce and protect the environment. SDGs contain 17 goals and 169 targets that are expected to be achieved by 2030. The Sustainable Development Goals define the world we want. They apply to all nations and mean, quite simply, to ensure that no one is left behind. And then, what is good health and well-being? Good health is essential to sustainable development, and the 2030 Agenda reflects the complexity and interconnectedness of the two. It takes into account unique economic and social inequalities, rapid urbanization, threats to the climate and the environment, the continuing burden of HIV on another infectious disease, and emerging challenges such as non-communicable disease. Universal health coverage will be integral to achieving SDGs 3. Ending poverty and reducing inequalities. Emerging global health priorities not expressly included in the SDGs, including antimicrobial resistance as the demand action. And then, what can we do about COVID-19 impact on public welfare and health? The implementation of social welfare itself requires the various role of society, whether individuals, families, religious organizations, social community organizations, non-governmental organizations, professional organizations, business entities, social welfare institutions, and for it, social welfare interaction for the implementation. This is because the social welfare problems that are developing complex indicate that there are citizens whose rights to basic needs have not been properly fulfilled because they have not received social service from the state. As a result, there are still citizens who experience obstacles in the implementation of social functions, so that they are unable to live a decent and dignified life. The government has made 4 strategies that will be consistently carried out to strengthen the physical distancing policy as a basic strategy for overcoming the corona COVID-19. The first strategy, as a strengthening of the basic strategy, is the mask movement for all those who campaign for the obligation to wear masks while in public space or outside the home. The second strategy is contact tracing of positive cases treated using rapid tests. Among them are the closet people, health workers who treat COVID-19 patients, and people in areas where there are many cases. The third strategy is education and preparation of isolation independently on some tracing results that show positive tests, results from rapid tests or negative tests with symptoms for self-isolation. The fourth strategy is hospital isolation. which is carried out when self-isolation is not possible. For example, because there are clinical scenes that need definitive service at the hospital. I think the video is enough. Thank you for watching. Bye.